All right, future nurse, let's tackle this NCLEX question of the day. So the nurse is caring for a female who is presenting for a prenatal visit at 34 weeks gestation. Which statement by the patient should the nurse investigate further? All right, so we're looking for any red flags in these answer choices. So option A, I have to take breaks when walking up the stairs because I get short of breath. So let's think about this. She's 34 weeks gestation. She has probably a very big belly that's pushing up on her diaphragm. On activity, she might feel shortness of breath, and we might expect that. Let's keep moving on. Option B, I've noticed that the baby is kicking less in the past 2 weeks. Okay, that's a subjective reporting. Kicking less, past 2 weeks, she's 34 weeks. I might be concerned with some perfusion issues, or maybe there's not enough oxygen getting to the baby. Why are they kicking less? Option C, I have my partner massage my feet at the end of the day because they are a little swollen after being on my feet for long periods of time. That's a great partner, and this is an expected finding. Remember, we have increased volume in our body. We can have some swelling of the feet. Now, if this was unilateral swelling with redness and erythema, then okay, maybe I'm thinking of a DVT, but they're not telling me any of that. It's bilateral. It's after standing for long periods of time, so I can expect that. And option D, I've been taking acetaminophen for my lower back discomfort. Acetaminophen is an appropriate analgesic to take while pregnant. Lower back discomfort doesn't really trigger any red flags in my mind. Remember, they are holding a baby, they are growing a baby, they're gonna have some strain on that lower back. They also might have some lower abdominal cramping as the uterus begins to grow. So I've kind of narrowed it down to options A and B. I can kind of expect somebody to be a little bit short of breath in option A because remember, like we talked about, if the baby's growing, is pushing on their abdomen and they can get short of breath with activity. Now, option B is a huge red flag that you need to know for NCLEX. If there is decreased fetal movement, even if it's a subjective reporting, you need to check that that baby is being perfused appropriately. Also, mom is in the 3rd trimester, so any changes or decrease in fetal movement, I'm worried about any circulation or oxygenation compromise to the fetus. I hope you learned something. Follow for more.